I'm Shannon Weber with Hive, a hub of positive sexual and reproductive health, and it's May 2015. We're in Washington, D.C. at the Elimination of Mother-to-Child Transmission Stakeholders Group. It's evening. This is why it's a little dark outside. And I'm here with...
I'm Rana Chakraborty. I'm an Associate Professor of Pediatrics at Emory University School of Medicine.
And thank you so much for doing this. We have made a video about this before, but now some of the information that we have has changed. And so I want to ask you about this Mississippi baby that got cured. This was in the news everywhere. You know, everybody's talking about it, from people who have nothing to do with HIV to everyone in HIV. So can you tell me really briefly what happened with the Mississippi baby?
Yeah, there was a baby born I think in rural Mississippi who was transferred up to a main medical center in Jackson at the University of Mississippi. The physicians were aware of the potential status, and they did what they could to offset, prevent transmission of the virus to the baby. And they gave a cocktail of drugs to the baby within the first few days of life, which is a little different from the national guidelines, but it was what was available. And then thereafter they followed the baby. Initially there was sort of a belief that the baby was infected, but then based on the initial tests, but then unusually the physicians were not able to detect virus for a number of months, in fact for more than a year. And so clearance of the virus raised a lot of excitement that this baby had potentially become infected, but then had been cured.
Right.
So that's really essentially the background. There was a group that did a lot of elegant work with the case, primarily initially because what had happened was the baby had fallen out of care, had not received antiretroviral therapy, having been diagnosed potentially with HIV infection, and was therefore not receiving antiretroviral drugs. But surprisingly to the doctors, when they were able to follow up with the baby, they were still not able to detect virus. And so that left a lot of questions. And during this time, physicians from Johns Hopkins and the University of Massachusetts had done a number of elegant studies trying to look into the background of what it was about the baby that could have affected a cure.
And then what happened later for the baby?
Well, unfortunately, after more follow-up, they did detect virus, and in fact, not only virus, but the baby's CD4 count, which are the important T cells that are important and prevent what we call opportunistic infections. The virus was detected and the T cell count had dropped. Therefore, we could probably say that the baby was not in fact cured and remained infected.
So what if we were going to look at what some of the quick lessons learned are from this, is that it seems that it's likely better if a baby is infected with HIV to get on treatment earlier, to be identified and get on treatment earlier.
Potentially, yes.
Potentially. It seems like when you're on treatment that you might need to stay on treatment in order to maintain whatever level of health that you're at.
Absolutely.
And then also something that we know is that this is primarily preventable, right? When the mom's in care. Thank you.
Thank you.
So now people have changed treatment guidelines but on their own practice. And so there's this question around really how moms should be counseled. So you have a mom who either hasn't been in care, or she comes in at labor and delivery with a detectable viral load, and you're considering offering her this other regimen that we don't have a lot of data about. And how would you counsel a mom about this? How does she understand the risks and benefits and being able to make a choice about where to go for her baby? Because all moms want their babies to be free of HIV.
So there's a few important points in this question. first and foremost, it's critical for mums to follow up if they find out that they're HIV infected. I mean, it's important for all mums to follow up routinely with their obstetrician during pregnancy, and for testing to be done in the first trimester, and in most parts of the United States in the third trimester as well. I think if HIV infection is diagnosed, it's critical that mums receive antiretroviral drugs so that we can do the very best to prevent mother-to-child transmission. In the event we have a situation where babies are potentially infected, it's obviously critical for the baby to be followed up, as you had sort of suggested at the beginning of the question. But also there are protocols right now, national protocols, that are using the same cocktail of drugs that the clinicians in Mississippi used for their particular baby, to again assess what it does in terms of preventing infection. I think we're still very early on in terms of where we are and whether this will actually be effective. There were obviously a lot of positive aspects about the Mississippi case, but unfortunately we think that the virus probably hid away somewhere and came back later on when the baby was not receiving.
Yeah, so there's more to learn.
So there's a lot more to learn, yeah. And so it's still very early days, but obviously we have to be encouraged that at least we have drugs that are doing the job, and there are a new generation of drugs coming through which babies can receive, which also could do a very good job in terms of preventing mother-to-child transmission.
Such good news.
Yeah.
Thank you so much.
Okay, my pleasure.